prickling in your feet, and I don't have any of that.
Neuropathy can be prickling in your feet. It can also manifest as just some numbness or a feeling of fullness, or it feels like I've had people say it feels like my feet are covered with cellophane, or... Okay, so when you come in, we'll start over. Okay, so when people come in as a new patient, which we're going to consider you a new patient, the first thing we do is we check the pulses in the feet. Now, you've got quite a bit of swelling in both feet. I mean, not quite a bit. I've seen much worse even today, but this is the kind of swelling that leaves a dent in here when you put, and that's most likely from the chemo. Now,
and so are the little prickly stuff, like coloration of it.
Yep. And so I'm not feeling any of your pulses down here in your feet, but my guess is that that's more due to the swelling than due to that you don't have any. Okay? So then the next thing we want to check, if you give me your hand here, do you feel the vibration there?
Yes, I do.
Okay. I'm going to have you close your eyes, and I just want you to tell me, do you feel vibration here or just touch? You feel vibration?
Mm-hmm.
Okay. So I want you to tell me when that vibration stops. Just say now.
Stop. I mean, it's, yeah.
Okay. And then on the other foot, do you feel it right there?
Oh, yeah.
Okay. Tell me when it stops.
It stopped.
Already? Okay. And how about here? Do you feel vibration or just touch here?
Maybe just touch.
Okay. And how about in this spot on this foot? Do you feel vibration?
A little vibration.
Okay. Tell me when it stops.
Stopped.
Okay. And then the last thing I'm going to do is with your eyes closed, I'm just going to touch you on the bottom of your feet with a little wire here. Okay? So go ahead and close your eyes. And I want you to tell me where you feel me touching your foot. You feel that? Okay. How about here? Do you feel that?
Mm-mm.
How about there? Anything?
Mm-mm.
Here?
A little bit.
Where am I?
Over here.
Whereabouts?
On my, it was on my heel, on the end of my heel.
Okay. How about here? Do you feel that?
Yes, on top.
Where am I? Top of what?
Toe.
Which
Big toe, maybe.
Big toe, which foot?
This foot.
Okay. And how about there?
Over here.
Whereabouts? What part of the foot?
No, on top.
Okay. All right. So you got all the ones on the bottom, kind of, you didn't feel them. So, you know, are you having the beginnings of some neuropathy from your chemotherapy? I would say probably. So, just something to notice. You probably don't want to be walking around the house barefoot. You should always have something on your feet, because if you couldn't feel my touching you, if you step on something, you may not know it. So always have some sort of sandal or shoe or slipper or something.
Right, we were looking at the sandals up there. Are they good choices? I have sandals.
Yeah, I mean, those are good.
Right.
The ones that we have in the waiting room. So, yeah, I mean, that would be a perfect kind of sandal. You can slip in and out of it.
Right, I have those. I could do the black ones or the tan ones, because they're easy to get in and out of.
Now, since you've been doing, how long have you been doing the chemotherapy?
Since October.
Okay, so about 6 months.
Right.
Have you noticed any change in the nails or?
I haven't, and one of the side effects, they said they're going to turn black, but they haven't yet.
Okay, they could turn black. Yeah, that's possible. Sometimes they come off, and sometimes they get loose. So we're going to start over on this foot, and we'll just get everything trimmed back.
You know, and this hasn't been trimmed since I went to Mexico in January.
Okay, so, and so they possibly are growing slower because of the chemotherapy.
Because the nail polish, we removed that.
Okay, and you said that you've lost a lot of your hair.
Right.
Okay.
It's just stupid stuff.
Well, but listen, you also said you're not nauseous.
No, I don't have any of those other side effects, bad side effects that
Good.
people have. Little neuropathy in my fingers right after chemo, and then it goes away.
Okay. So I would say you have a little bit of neuropathy on the bottoms of your feet as well.
And I don't notice that, but...
Right, but you maybe wouldn't.
Right.
So just the best thing that you can do is not walk around barefoot, and you know, just to always have something under your feet. The other thing would be to visually check your feet every night. So every night before you get into bed, look at the bottoms of your feet and look at, in between your toes, and all we're looking for is something different. So if anything looks different and is any kind of concern, if you get on the phone and you use the words neuropathy and infection or neuropathy and I'm concerned, we'll get you in that day, if we can. If you don't call us at 3:30.
Now, how old is your daughter?
She is gonna be 21 in a couple of
Oh
weeks.
my gosh, see, I was here when you just got her.
Yep, and she's in her, finishing up her junior year at the university here.
Nice.
Yeah.
Oh my goodness.
Yeah, so it has been a long time since you were here.
Right, well, I was here in between maybe. I had a broken something foot. I don't know what you did with that. Remember after my knees, I had the table fell on my foot.
Yeah, if it's been more than 7 years, we wouldn't have your chart anymore. And I think it's been more than 7
Right.
years. But that's a good memory, you remembered my daughter.
Right. And you travel a lot?
Well, now that she's in college, not so much,
Not so much.
for a while.
Right.
But, yeah, I love to travel. In fact, when she was 5, we went back to China, to the orphanage that she had come from.
Uh-huh.
And that was pretty spectacular. More for me than her, probably.
Well, I have known people that have gone back to Korea. You have too, Julie.
With adopted kids.
Yep. That toe at the bottom looks a little brown, right?
This one?
Yeah.
No, that's your nail polish.
Oh, that's a nail
That's
polish.
still some nail polish.
Uh-oh.
Okay, So here's what I want you to know. I don't take on new patients for this, but given what you're going through, if there comes a point where you need foot care and you're not well enough to make it in, I will come out to you, okay?
Well, aren't you wonderful?
Well, I do that for patients who have been patients for a long time, if there comes a point they can't get in anymore, so.
This
Yeah, I'm just gonna, we'll lotion everything and then.
Yeah, I lotion them up every night with.
Yeah, the skin looks really good. What do you use?
well, right now we're using a
It's
special
something
cream.
that somebody recommended that they use in the hospitals. It's,
Aquaphor?
no, Aquaphor I use for other things, but
It's a little thinner cream than Aquaphor is. It's a little thinner. And initially we were using something that was probably too thick. And we have a nurse friend who said, you need to use a thinner cream because the skin needs to breathe.
Okay.
And once we did that, we seemed to be getting good results.
Okay.
But it is something to use at St. Joe's, I know that.
Okay.
It's one of our friends
Well,
would
it's
say.
working because everything looks good, so
can we use polish on these now or not?
Absolutely. No reason you can't.
Now I can polish them back up.
Yeah.
I took the polish off because I knew you want to see
Oh.
the nail
Yeah,
and
the
see how,
consistency.
and see what things were like.
Right. Well, thank you for letting me video and take the conversation that we have, and I appreciate it.
Thank you.
You're welcome.